professional. It is a huddle they do every day. It's a system they've implemented. The staff were on it and taking it very seriously. So I was very reassured.
Doctor, did you get a sense when you were there of the mood of the patients and the families in the hospital, and how concerned are people and how concerned should they be from your perspective?
I did not meet with any patients or families. I do know that Franklin County Public Health and the hospital have a plan that they're working on together to help get information to families, and you can certainly go to their website to get more information. I think the hospital had shared that they did rounds last night. The medical staff went out floor to floor and are talking to everyone. I also witnessed them assigning folks to be that person, and if families had questions, they were going to get them someone to talk to right away.
How do we balance in a situation like this? We were discussing this earlier. You know, it's fairly common in Ohio to have legionella and legionnaires pop up, especially this time of year, but not necessarily in a healthcare facility. What do you say to people about taking it seriously but not panicking? And, you know, what should they do if they are suspected of being sick?
So we take legionella very seriously, and I think you'll see this governor and this health department be very proactive. We don't want to get in a situation of being reactive. So we're going to be a lot more forward than maybe folks have seen us be in the past. We have one of the highest rates of legionella in the state. There's a lot more we could be doing about it, and this is something my team will be advising me on moving forward. As you know, I've taken this job. I think this might be the weekend of 3 months. But this will be something top of mind for me. I think, you know, the CDC has very clear guidelines on intervening, and we are following those guidelines. I couldn't be more proud of the team we have. I pray every day we never lose. Please do not retire our amazing staff, because we really do have some wonderful epidemiologists who, I might say, picked up on this case using our surveillance methods. And this is important for Ohioans to know. We have a very detailed surveillance method, and we must support these things. These are the hidden things that protect us. And by picking up on these cases, they, along with the local health department, reach out to the hospital. And we're able to say, there is this cluster that we picked up in our reporting of laboratory data. So I think that allows us to move more quickly with interventions, which in this case are flushing the water lines. They've stopped all water flow at the hospital. It's being chlorinated as we speak. There is no ice in the hospital. There's bottled water everywhere. And there are detailed interventions going on to protect people. And by knowing as soon as we knew, that allows us in the hospital to take steps quickly. So I think in looking for the symptoms of the disease, legionella can look like the flu. It is often a cause of pneumonia, coughing, fever, headache. In a normal, healthy person, you might just think you're sick and not notice it. But it is very dangerous for people who are at risk. It is more dangerous in smokers or people with chronic lung disease, people who are on chemotherapy or autoimmune drugs. They are more at risk, and certainly a hospital population presents a population that is more at